afternoon. I'm Baaba Halm, the Vice President and Market Leader of Enterprise Community Partners. Enterprise is a national nonprofit that exists to make a good home possible for the millions of families without one. In New York, we work with government and community partners on capital, programming, and policy to create and preserve affordable housing and to enable housing access. So I'm so delighted to be serving as the moderator for today's conversation with our executive state leaders around the state's response on homelessness, housing, and behavioral health. As you all know, our state has been struggling with rising homelessness due to a lack of affordable housing supply and the dual challenge of growing behavioral health need. And so the state's response on these challenges is imperative. Thank you to Commissioners Cunningham, Sullivan, Visnauskas, and Executive Deputy Commissioner Guinn for joining us today. There's so much to discuss and understand about the state's approach to these important issues. We're going to start with introductions from each of the panelists about their work and their agency's role on these issues, followed by some questions from me, and then we'll take questions from the audience. So starting with Commissioner Cunningham, please introduce yourself, your agency's role on homelessness, housing, and behavioral health.
Good afternoon. Happy to be here. I'm Chinazo Cunningham. I'm a physician in internal medicine and addiction medicine, and I have been the commissioner of at OASAS for a little over a year and a half. So I spent a lot of years, my whole career, 20 plus years, working in the Bronx in academic medicine, providing care for individuals, and really seeing the destruction that drug use had in the community that I served, really in the South Bronx. I worked with community-based organizations to do outreach in single-room occupancy hotels, SRO hotels, for a decade in the South Bronx and in Harlem to really meet people where they are. So going outside of the walls of the clinic, meeting those who were most marginalized, who were, at the time this was late 90s, early 2000s, who were HIV infected, who were homeless, and who were using drugs. So that was a big part for me that shaped my vision and coming to OASAS and the work that I do. And so really my focus at OASAS now, with the worst drug overdose ever on record, is to approach our work using a harm reduction lens. So we can't wait for people to come to us. We have to go out and meet people where they are. We have to provide services in a way that's low barrier and no barrier, low threshold. We need to recognize that people will use drugs as they have for hundreds of years. We have to recognize that substance use is a chronic illness, does not have a cure, requires lifelong management, and a lot of that includes relapse. And so what does that mean when we think about housing and services? So really taking a harm reduction approach, keeping people in services, and helping people live healthier lives, even if that means that they don't reach abstinence. So harm reduction is a key principle. Another key principle is using a data-driven approach. So really focusing on where the hot spots are, where people who are at risk for overdose, who are using substances, what kind of services are available or not available, who are we reaching, who are we not reaching, and making sure that we're providing evidence-based services and really matching the need to the services and making those investments. And so really using our data, doing evaluations, making our investments impactful is really another key principle. And then the third principle is using an equity lens in what we do. So again, having been a physician practicing medicine in the Bronx for 22 years in the South Bronx, 99% of my patients were Black or Hispanic. I saw the destruction that our drug policy has in this country on communities of color. We have racist policies. We have to say those words out loud and acknowledge that, and we can't continue that, and we need to do better. And so, for example, when you look at the overdose epidemic, it's Black people, Native Americans, and Hispanic people who are dying at the highest risk, and so our investments need to make sure that we're reaching those who have the highest risk. Equity is not just about race and ethnicity, it's also about LGBTQ status, it's about geography, rural versus urban. Really, again, making sure that we're reaching those who are at highest need and underserved. So that's my big spiel. I don't know if you want me to talk about how housing goes into it, or if we're going to get there.
I think this is a good time to talk about how housing goes into it before we go to the other agencies.
Okay. Yeah. So compared to the other commissioners here, housing is a much smaller portfolio in OASAS than in other agencies, and we are a small agency, but certainly recognize the importance of housing in the world of addiction. And so we have across the agency almost 3,000 units, and we invest $46 million in these units, and there are a variety of units. So some of them are really focusing on case management programs, permanent supportive housing. Certainly in New York 3 we have a reentry program for people coming out of jails and prisons. We have a transitional safety unit housing, which is a new area for short-term placement so that people can transition as they're going from residential into more permanent housing or from out of carceral settings. So really a variety of housing needs to address substance use. And then other areas that we're doing more work in include in homeless shelters, so new initiatives to do in-reach in shelters, again, bringing services to where people are in homeless shelters. We know that overdose risks are extraordinarily high in this population, and really bringing services in those settings. And then recovery housing is another big area for us, too. Never been under the OASAS umbrella and is now going to be shortly. We just published our new regs that are out for public comment, and so this is an area that I think is really important, that has really not been part of our system, but it's important to sort of bring under the system and make sure that we have clear standards that are being met. So that is kind of just a nutshell of where we are and how that fits into our vision.
And we certainly are going to talk more about aspects of that vision in a little bit. But Commissioner Visnauskas, if you want to talk about your agency and the work.
Sure. Although if I talk after Dr. Cunningham, I feel like my job is a lot easier than hers. So it's a lot. So I'm RuthAnne Visnauskas. For those of you that don't know me, I have been working in housing for a long time. I worked at the city in the Bloomberg administration and have had the pleasure of being now at the state since 2015 and in this role since 2017. So I've had a nice long time to understand the work we do and try to make it as responsive as we can to the people that we serve. For me, sort of on a personal note, I can spend all day talking about being in government and talking about housing, and I try to do that so that other people don't have to talk about their housing and don't have to worry about their housing or think about their housing, ultimately with the goal to make sure that everyone does have access to affordable housing and have access to it where they want to be in the communities that they want to live in. Although despite having done this for a long time, the challenges are as big as they've ever been and sometimes even feel greater than they ever have been across the board. And for us, certainly the supportive projects that we do and the sort of supportive pipeline is really central to that. We are still committed to the 15-year commitment to create 20,000 units of supportive housing and work with so many people in this room to make that actually happen and hold us accountable to that commitment. And so for us, that's certainly very central to work that we do in New York City, but also really in every corner of the state. And I think have had wonderful success working with our network of partners to really bring supportive housing to places that maybe it wasn't so prevalent in places, in the time before we started the housing plan. So, looking forward, I think we'll sort of continue that work. And we have, I think folks know, sort of recently, in response to Ginny's request, also looked at providing some capital that we got last year in the housing plan towards preservation of that. So we are sort of equally, or maybe not equally, but additionally sort of focused not just on the new construction of supportive housing, but also making sure we can keep every unit that we've built in the last couple decades in good working order and habitable. So I think I'll pause there.
Okay. So Commissioner Sullivan?
Hi, thanks. Hi. Good afternoon, everyone. I was asked to talk a little bit about how we got into this field. So I trained at Bellevue Hospital more decades ago than I want to say, but it was in the late 70s, early 80s. And that was right around the peak of deinstitutionalization when we were all seeing individuals. And we had a training unit. And the training unit had a relationship with the residence. And the residence was the St. Francis. The St. Francis, which was a few blocks from the Bellevue. And I remember, even then, the clients that I worked with who went to the St. Francis did so much better than the clients who went to then, which were warehousing hotels all across the city. And I began to think, even then, that, it's not enough to have a clinic visit or a visit to a hospital, if that's what you need. What you needed was an environment, a community, something where you could recover from serious mental illness and get all the supports you needed. And the St. Francis was the beginning of that. And now the state has over 47,000 units of safe housing for individuals with serious mental illness, units that weren't there 40 years ago. And thanks to all of you who've been doing that work and making that real. And so when you talk about housing and mental health, there's no difference. It's all together. It's all one picture. They all come together. Because if someone doesn't have a safe place to live and a safe place to put their head at night, then everything else we try to do, we know, just doesn't work very well. So the biggest part of recovery is that part of the environment. And that's why it's embedded so strongly in kind of what we do. And why, in the governor's recent proposal, it's another $800 to $900 million for supportive housing just for individuals with serious mental illness. And that's remarkable. That's a remarkable commitment. And I'll be talking about it in details later, but without that kind of thread going through, you can't do the work that we all want to do. The second thing that's kept me in this field has been the people to work with. From the times I've worked in clinics, I've worked in hospitals, I worked in the Queen's Health Network for many years. Now I've had this position for 10 years, but it's always been a combination of the clients that I've worked with and the people that I've worked with. And that includes a lot of you who I know, some of you who I don't, but it's been a wonderful, wonderful partnership. And I just have to give a shout out to someone who is taking a moment of what they call personal privilege, to give a shout out to Bob Myers, who's retiring, who I think probably everybody in this room knows, and who has been someone who has taught me so much about housing and has been a voice, an endless, never-ending voice for improving housing across New York State. And I don't think we could have done what we've done on the state side without Bob. And where is he? So. So again, a huge thank you to you. I'll be going through the details of the housing, but just one other word about the budget, which I won't talk about again, is that it really does not just deal, though, with individuals who are struggling with serious mental illness and living and recovering from serious mental illness. It's a lot of dollars in there for school-based services for kids post the pandemic, a lot of dollars to expand our clinic system for New Yorkers who have been really responding to this pandemic, dealing with it, but also we know that we've had too long wait lists in our clinics. We haven't had access. So access is a top priority. Access to housing, access to care, access to all the services that we provide. So the budget really, that $1 billion that everybody's talking about, spans all the way from prevention, working with youth, with kids, with families, with young kids, through building the bones of our infrastructure for our clinic system. All these services are really well integrated with substance use that we're putting up because the time has come that that's what has to be. We're also integrating a lot of the services with individuals with developmental disabilities. And then there's the services for the individuals who have significant mental illness and really need extra supports. And that's where all the housing dollars come in. But I'll talk about them later, but 3,500 units of housing is pretty impressive in one budget year. So we're really very excited, and that's what the vision for our is to implement really the governor's plan to really provide mental health access for all New Yorkers.
So vision and leadership are key components of being able to really kind of execute. Congratulations on your retirement, Bob. Executive Deputy Commissioner Guinn?
Yes, thank you. Good afternoon, everyone. Would definitely agree with the comments of the commissioners just with respect to the challenges that we all face. In some ways, things are harder now than they have ever been, but definitely pleased to see the great leadership that we have in New York State, where these people are saying that they really are focused on the most marginalized and making sure that we're reaching people who are truly in need. They're not just saying it, we really are doing it. And it's a shift I've noticed. And now having the administration support, $1 billion investment in mental health, who would have thought? It's fantastic. So, it's challenging, but we do have people who understand what's needed to make a difference. And we know all of you do. It's the work you do every day. At the State Office of Temporary and Disability Assistance, we do a lot of different things. A large portion of our agency is focused on just helping people meet their basic needs in terms of the delivery of public benefits. In the area of housing and homeless services, our role is in a couple of different areas. One is importantly with respect to oversight of local social services districts. They are the entity and the only entity that is legally obligated to make sure that individuals who are homeless are cared for. While there is some work we can do to define that legal obligation, we have work to do there, but they are legally obligated. And so we work with them on homeless housing, Code Blue related emergency outreach and shelter, and as well as public assistance related funded rental assistance and also rental supplements. We also contract with a large number of nonprofit providers to provide a range of prevention and homeless services, shelter services as well. One of those contracts is the New York State Supportive Housing Program, which I think many of you are probably a part of. So we're pleased to play a role there. And then also for the past 2 years, we have been charged with the responsibility of administering the Emergency Rental Assistance Program. Through that program to date, we have distributed $3 billion in payments to support arrears. And thanks to some additional funding added in this past state budget, as well as a final federal award received in April, we will continue to do that work for many months to come. And of course, importantly to the group here also, we administer the Homeless Housing and Assistance Program. HHAP, as you know, provides capital to support supportive housing as well as transitional and shelter services. And this year is the 40th anniversary of HHAP, which we are very proud of, and proud to say that as a result of the investments through HHAP, we've been able to create over 26,000 supportive housing units in the state. Now, not everyone who experiences homelessness requires supportive housing, but I would say that the debate is over, that supportive housing is definitely the solution to homelessness for many that we serve. I had an opportunity yesterday to visit a couple of the older supportive housing locations and just really impressed by the commitment of the staff, the obvious relationship that they have with the residents of the housing. It was truly just housing providing dignity as well as providing much needed services and staff that really obviously care about the residents' well-being and making sure that they are safe and healthy. One thing that we have spent some time doing over the past year has been trying to develop additional partners in the space of supportive housing. Outside of New York City in particular, it's not like it is in New York City in Western and Central New York in terms of having enough providers in this space. And so our staff with our Housing and Refugee Services Division have spent time holding workshops, listening and bringing communities together to talk about the needs of the community and also housing solutions. And we have, fortunately, we've already seen that this has made a difference in developing partnerships, and we have had, as a result of these discussions, new first-time applicants for HHAP in areas that are underserved with supportive housing. So I thank my staff for the work they've done to make that happen. I've been with OTDA, I think, since 2005. I really love working with the agency. I think because of the range of services that we provide, kind of a continuum in terms of, the delivery that we provide to communities throughout the state. Some of the services are very short-term in nature. Others are long-term, like supportive housing. But each and every one of them really has a meaningful impact for each individual and each family that we're able to help in their time of need. Together, the work that we all do and that you do day in, day out definitely makes a big difference. It's meaningful, it's impactful, it's inspiring. I hope you're all inspired by this conference. What an awesome opening we had this morning. If that didn't inspire you, then you must have been asleep. It was really just what a great way to view the world. Love is love is love. So, there's a lot of work we have yet to do. Optimistic about changes. We know that there are places where our investments are not acceptable, that we need to do more, and certainly promise each and every one of you that OTDA, myself, and our team are committed to moving the ball forward and advocating for this important work. Thank you.
Okay. So, Commissioner Sullivan, you talked about the historic budget, that $1 billion mental health plan, and it certainly was a major achievement in this year's budget after decades of disinvestment in the system. So could you give us a little bit more into what the budget covers and how housing fits into that budget?
Sure. First of all, I think everyone is aware that there was a commitment made even 2 years ago for $104 million to be invested in the general supportive services of housing. 69 million, I believe, was last year, and then there was another 35 this year. That did happen, so that 104 million is safe and it's there. In addition, in this particular budget, there is a close to $900 million for supported housing. That's 3,500 units of supported housing. And basically the breakdown of those 3,500 units, it includes 600 supported apartments. It includes 1,500 supported housing, a mixture of scatter site and permanent housing. It includes bringing back, and this is where we're going to be working with all of you of what that would look like, about 500 units for CRSRO. And I never get all those acronyms straight, but it's the most intensive and more of a transitional, because we found over time, largely you guys have brought it up to us, that our housing, sometimes people aren't ready for apartments or to go into other kinds of housing. They need something more supported. So we're going to be working with you on those units. And then there's 900, what we're calling transitional units, which is a brand new model that we are also discussing with all of you what that should look like. And those transitional units will be particularly focused on working with individuals leaving hospitals, emergency rooms, jails and prisons, giving them the opportunity to have an enhanced experience. The staffing will be enhanced in those, giving them the opportunity to have a transition. Maybe, we're not sure of even length of time, but we're talking maybe 6 months, something like that, where 3 to 6 months, where individuals can again be stabilized post something that destabilized their lives, whether it was in jail or whether it was a hospitalization or whether it was an urgent visit to emergency room or someone who's been on the streets for a long time and now needs to have some housing. So it's 3,500 units. The RFPs for the more traditional apartments and group of the scatter sites and stuff are already starting to come out, so please keep your eye out. They'll be coming out in the summer and into the fall. Some of the newer things that we are designing, and some of the newer transitional units will also serve individuals with dual diagnosis. So we're looking at individuals who are using substances and serious mental illness, but also developmental disabilities and serious mental illness. So putting those two together, there's been a huge problem of that, basically, in hospital emergency rooms. But another big piece, in addition to the housing, are the supportive services that are going to be built around the high-need individuals. And that includes a significant increase in ACT teams. In the state right now, we have about 120 ACT teams. We're adding another 42. That's huge. We're adding 50 CTI teams, critical time intervention teams. This is a new model. It's something like Pathways to Home. For some of you in the city may know that. These teams will be connected to individuals in that transitional housing and in other transitional housing, helping them really get the services and the connections they need in the community. They will stay with individuals for up to a year, doing just about anything and everything somebody needs for that transition. We've had significant success with this already in a model that we've begun with what we call, for the seriously mentally ill who have unsheltered on the streets in New York City, where individuals come in, they can join, these teams do the initial outreach, they work with the clients. If they need a hospitalization, they may go into the hospital, they'll work with them through the hospital. They work with them as they transition to housing. We're using a housing first model with some of these clients, where this team works with them as they move right into supported housing. The team stays with them until things are stable. It's working. It's working. We've had individuals who have gone into a brief stay in a psychiatric hospital, moved to housing, who have been 10, 15 years on the streets. And what makes the difference? It's teams like this that pull all the services together that provide the kind of relationship that helps individuals really take a chance on us, because many people on the streets have not trusted us very well, to take a chance on us and what we do and get connected. So it's bigger than just housing. It's the connecting services. The other thing I know that you have often brought to our attention is the issue of when you are working with a client and the client has significant difficulties and you bring them to the emergency room, that you don't get the response that is most helpful. Let me put it that way. So the reality is we're going to be doing collaboratives across the state, and we mean business about this. We're giving the hospitals the assistance of these critical time intervention teams. We're giving them other resources. We need them to work collaboratively with the community-based services. So you'll all be a part of that, where we're going to make sure that there's a different approach when individuals are in need and may need to go to a hospital. So that's something which you're going to be hearing about. We need you to be part of this. All our field offices are going to be pulling this together, and we're going to be working with the hospitals together. And now we're giving the hospitals, because in fairness to them, for the first time, there's peers in our CPEPs. So they will be there and be available. The CTI teams have peers. They will be there and be able to make those connections. So when someone leaves an emergency room, they'll have someone to see them, and hopefully a place also, after we get some of this housing up, for them to go to sleep that night that isn't on the street or the shelter, that they have something which is supportive. So the whole array of services is a wraparound. So I just want to emphasize that the housing is kind of the core. But as you all know, without the other services around it, it won't be as effective. So that's a thumbnail of where the housing generally fits in. And then there's lots of other community-based services, clinic appointments, everything else, which will be increasing.
And, I mean, from what you've just described to us, it seems that this budget is really going to be supporting some innovative programming, tackling some of these long-standing challenges and concerns that the providers have been talking about. So that's really exciting to hear. So Commissioner Visnauskas, last year's budget had allocated capital funding for the first time to preserve some supportive housing units, 3,000 units over a 5-year horizon. How is that effort going? What else may be needed to ensure that capital is allocated expeditiously?
It's going a little slow. So consider this sort of an advertisement to all of you that might have an old HTFC supportive housing project, or a old DHCR tax credit project, or an old HFA project, or a OMH funded, or an OTDA, an old HHAP, really any sort of existing supportive. One of the things we were trying to do, we have, as many of you know, a pretty sort of decent pipeline of projects waiting to get financed in our 9% and in our 4%, sort of our two routes the folks come in. And so one of the things we wanted to do with this funding was actually sort of try to provide it outside of those two funding streams. So really for any project that just needs some capital investment that doesn't have to do a full comprehensive sort of re-syndication, we want to make sure there's capital available so people can be doing interim roof investments or boiler investments or whatever types of upgrades. We really want folks to see this as the ability to come in some way sort of like mid-cycle and be able to carve sort of a scope of work out and get it done. It really is intended to be capital that's available for owners to be able to put in the buildings, but it doesn't have to be on cycle with doing sort of a major overhaul, because we know it is partially, but doing 9s and 4s, it takes a long time and it's expensive and it's a big undertaking, but also not every project necessarily needs that right now, so we don't want people to wait. So I would really encourage folks that have existing supportive housing projects that they can come in and get sort of a subsidy only, or if you could go to a bank and do some refinancing and we could be a second, that's fine too. Really anything that would work. Also happy to have them come in through our pipeline as needed, but as many folks know, it takes a long time to get through our pipeline. So we'd really love to encourage folks to be looking at ways to get capital just invested in these buildings at any point for a discrete scope so we can get it out the door and into the buildings where we want it to be.
Great. So you heard that. They're looking for partners. So Commissioner Cunningham talked about how her team hit the road to find new partners. So maybe that's a good model that HCR can consider as it searches for more supportive housing units to help preserve. So turning back to Commissioners Cunningham and Sullivan, we're hearing from supportive housing and other providers that mental health and substance use needs are increasingly intense. More people are disconnected from mental health treatment, and the opioid crisis is even deadlier. So what thoughts do you have on how to layer more intensive services into supportive housing, which does not fund or provide clinical services? And how can we achieve better integration between mental health and substance use services?
So let me just say the issue about integration of substance use and mental health services, this is something we're hearing all the time, right? So it's not at all specific to housing, it's really across the board. And we know, that at least from our standpoint, when we look at who's coming into services for addiction, we know that 3/4 of people have, mental health symptoms. And of course, there's a smaller but significant number of people with severe mental illness. So we know that we need to do better. What I would say, and just as one example of this is, so we have opioid settlement funds now available, and we have an opioid settlement fund advisory board that we meet with regularly, and we've heard from them that they really want, in all the initiatives in terms of how the dollars are spent, to make sure that we're addressing co-occurring disorders of mental health and substance use disorders and equity. So this is something that we're doing and really thinking about across the board, really with kind of all streams of funding. And Commissioner Sullivan and I are in meetings like all the time together. We see each other all the time. So we're constantly talking, and our teams are constantly talking with each other. And so, I think certainly for us, it's a lot easier to think about how to integrate services that are new we're still, trying to figure out how to do better with the existing system, but clearly when we have new initiatives, it's a lot easier to build in this, really from the beginning, thoughts about how we can do better. So let me just give you some examples of the way. So CCBHCs, you heard Commissioner Sullivan talk about, we're going to be tripling them. We're super excited about that at OASAS. And that is one way, right, where the staffing has to be appropriate for both substance use and mental health services. It's, no wrong door coming in. And so tripling the number from 13 to 39 across the state is one great example. The crisis stabilization centers, this is another new initiative, right? So 24/7, open doors, again, staffing around substance use disorder or mental health crises to make sure we can address both of those issues. We just... Another example, we just put out a press release this week about scholarships for training so we can get more people into the field of addiction. And some of that training is going to be going to people working in OMH clinics. Some of that training is going to go to people working in the Department of Health clinics, not just the OASS clinics, right? So these are just examples of the way in which we're saying we know that we have to support this work across systems. And, because really we should be able to address mental health in the OASS system and be able to address some substance use in the OMH system. And so we're, as we're putting new stuff out there, we're constantly thinking about how we can integrate services and really thinking about across the systems across the state.
Yeah, we truly are working together all the time. And as we've designed the services, and even as we planned for what would be part of the increase in services. It was always built around the fact that these services had to be integrated care between substance use and mental health. And the CCBHCs are a great example. There's many ways to expand clinic services, but we put a huge investment into expanding the CCBHCs. Why? Because they've had some of the best track records of integrating mental health and substance use care. When you look at the data from those CCBHCs, they've significantly decreased psych admissions, substance use admissions, medical admissions, psych, substance use, and medical ER visits because they integrate care. So when you look at the data, they've been really successful. And that's when we triple those CCBHCs, it goes from them serving about 90,000 people to now serving about 300,000 people. So that offers a real entry into the whole clinic system, on the whole community system of integrated care. And I think the stabilization centers, another example. They're licensed dually. We do them together. All the ACT teams we're putting out are going to have special trained members who understand substance use and are part of it. The CTI team, as I mentioned before, they're going to be integrated substance use and mental health. So all that's happening. Now, for the base clinics, we've also had for a while an opioid initiative, which maybe some of you know about, don't, that our clinics have been involved in about 400 clinics, and about 100 of them so far have graduated into providing full medication-assisted treatment and opioid treatment in a mental health clinic. And you don't even need a dual license for that. You can do that with just a mental health license. And that's been collaboratives that have been going on around the state, and we're growing that because that's something else. I mean, I think it's training, and we're getting into that. There's going to be more and more training coming out because the workforce that's been used to the siloed system isn't as adept at integrating. So I think that we're doing a lot of training. And then lastly, I think we have to get very creative about the services that are there. There's a program in the city where a number of our housing providers have worked with Oasis clinics, and the Oasis now, and now we have it in mental health, but Oasis first had the ability to be a rehab clinic, and as a rehab clinic, you could pay for services outside of the clinic. So those housing providers have Oasis providers coming in, and there are OMH housing providers, have Oasis staff coming in, running groups, seeing clients with substance use problems from the Oasis certified article clinics coming in. A similar thing can be done with our core services. Those core services now can be outside the walls of the clinic. They can come into housing and provide services, and the clinics can bill for it. And so there's a model for that on the Oasis coming into our housing. There's also an internal model for us to have more services for individuals in housing through the core services, clinics partnering with housing, and then individuals going and seeing on site in the housing and getting paid for it. So I think those are the kinds of things we want to work on. The pilot in the city's been successful, so we'd love to spread that, and it really makes the kind of integrated care work in housing. And then in addition, we're working on a design with Oasis for some of these transitional beds that I talked about, having specialized substance use and mental health services. And we're trying to figure out a design of how that will be and how some of those intensive services will be designed, both for that and for other housings. So there's a couple of things that we're looking at in terms of directly enhancing housing services as well. But there are community-based services that can now come into housing, and we'd be really glad to go through that with you in some ways about that pilot in the city, which is very successful.
Great. So we're looking forward to the strengthening of the relationship between the agencies and that integration between mental health and substance use services. Commissioner Cunningham, I think this is a good time to talk about the opiate settlement updates and the programs that are available for people experiencing homelessness and living in supportive housing.
Yes, great. So I get questions about the opioid settlement funds all the time. I know it's a lot of interest and certainly appropriate for a lot of the companies, pharmaceutical companies, the distributing companies, to really address the harms that they've been part of in New York State. So this past fiscal year, our budget was a little bit over $200 million, and then the same is going into this current fiscal year. So as I mentioned, we have an opioid settlement fund advisory board that we meet with, and there's a sort of a large chunk of money that they provide their recommendations on that we then follow. Another sort of pot of money is money that goes directly for, it's called regional abatement, which goes out to all of the counties across the state, and they decide how they're going to use those dollars locally. And so that's a little over $60 million that have already gone out the door across counties. New York City is a little bit different, along with Long Island, where there were opioid settlement dollars that came straight from the Attorney General and not through the state, and then they decide how they're going to use those dollars. So I can't actually comment on how necessarily New York City or Long Island is using those dollars, because the state was not part of that. So there's a lot of different kind of pots of money just to be aware of that are out there, and the state has a role in a lot of it, but there's a lot of also the roles of the localities to really determine their how they use those dollars. But so in terms of sort of the big picture for us for opioid settlement funds, what we heard again loud and clear, overarching themes from the advisory board were about making sure that we're addressing co-occurring mental health and substance use disorders, and making sure that we're addressing equity. So those are built in to all the initiatives that are coming out from the dollars. We also heard from them that priorities are harm reduction, treatment, providing services across the continuum. Those were sort of the top three. And then there's other areas like special populations that includes people involved in the criminal justice system, people who are not housed, adolescents, etc. And then there's other sort of categories of money, including prevention, recovery, housing, transportation, research, etc. So I would encourage you. We have dedicated websites for opioid settlement funds. So all of our meetings are open to the public, and so they're all of the. So you can see the report that the advisory board provided, and then all the meetings are recorded, and then you can see in another webpage all the initiatives that are coming out with these dollars. So the housing dollars specifically. So we are in the process right now of really determining how to use those housing dollars. So when we started with the top priorities, and that was harm reduction, treatment, and services across the continuum, and then we're working our way down to prevention, recovery, and housing. So we're in active discussion right now about how to use those dollars. And just to give you an idea of the dollar amount, so in fiscal year 23, it was $12 million. In this fiscal year, it'll be $13 million. So it's $25 million. And we're thinking about, also these dollars for the opioid settlement funds, we're starting out with a lot in the first couple of years, and then it sort of drops off pretty quickly. And so we want to make sure that we're thoughtful about using those dollars over the course of, several years. So, soon, you'll hear more about this, but just to know that we're thinking right now about how to best enhance the services that exist. Again, working with thinking about co-occurring disorders and thinking about equity.
Great. So, Executive Deputy Commissioner, you talked about the original supportive housing program, the New York State supportive housing program that created 26,000 units, I think was your number that you cited earlier.
That was HHJP.
Oh, HHJP,
Yep.
Okay. So the New York supportive housing program has funds 20,000 units at just a fraction of the services budget that ESHI and other more modern supportive housing programs provide. Is the state thinking about ways to create parity across all supportive housing programs?
Yes, we are. We definitely are well aware and acknowledge that the NYSHIP rates are a fraction of the rates that are available for services through ESHI or other, as you say, more modern funding streams. There's really no good reason for it, to be honest, and we certainly have been advocating and will continue to be advocating to create equity. These are units we don't want to lose. They're important. There's some of the providers that stepped up early and have held in there, and we want to make sure we're continuing to support them. We are providing the bit of flexible funding that we have for the past couple of years, where we have an increase in our homeless services appropriation, used those funds to increase NYSHIP rates. And so we will be doing that again this year. It's not a lot. It's $2.8 million spread across the units. But that is, it's a priority for us, so that is how we'll be using those funds. We certainly appreciate the advocacy from Shinny on this topic, and certainly look forward to working with you to see what we would be able to hopefully achieve in next year's budget. But we're well aware of the discrepancy, and we are committed to not losing these units.
So shifting a little bit to the challenges that supportive housing and affordable housing owners and operators are facing right now around the rental arrears crisis and the increasing operating costs. What strategies are being considered to ensure nonprofit owners and their properties remain solvent? And this is really for the panel, to the extent that you want to comment on that question.
Happy to start.
Sure, go ahead. Yeah.
So, we have been fortunate to have an influx of funding for arrears, but we hear, even with all the money that is available, we certainly hear that the arrears crisis is a real crisis for providers. We, as I mentioned earlier, we have been able to distribute $3 billion in arrears support through ERAP. We expect to, in the near future, distribute another, $400 million in arrears funding through ERAP. I would also encourage folks who, and I think I just want to mention too, an important part of that, the legislature's add of money there has basically given us what we believe the ability to be able to support most, if not all, of the applications from subsidized tenants. As many of you know, the legislation as it was created made the subsidized tenant applications be considered after all other eligible applications were paid. There was some rationale behind that, but at the end of the day, it's the same, it's low-income households residing in often in locations where people, those landlords really need that assistance. And so we are starting and have begun processing those applications, and we are very thankful that we are finally able to do that, because we know it has been a very long wait, 2 years waiting for that. I would also just encourage, if you're working with individuals that you believe would be eligible for a public assistance arrears funded benefit, please encourage them to apply through the social services office. You don't have, it's a higher standard in terms of the eligibility. It's still not extraordinarily generous, but the income thresholds are higher. And so if individuals are, especially if they're in a place where they have the ability to support payments going forward, it would be really important to work with them, or have your case managers work with individuals to apply for that assistance.
I would just add on to that. We're very aware that there's a lot of stress in rental collections in the portfolio across the state, and sort of amazing that despite distributing almost $3.5 billion of ERAP arrears, that it is, I think people feel it as much today as they did in the height of COVID. We would definitely encourage everyone. We have been sending out quarterly surveys to our portfolio. Would definitely love if people would respond to those. It does help us sort of track from a data perspective where things are. We have tried sort of post-COVID to do a couple things to help. We have released a lot of project-based Section 8 voucher ability through our RFPs. If it's something that an owner thinks would help them, they should reach out to their asset manager within the agency. We also got this change called, catchy, PHFL 610, if you haven't heard of it, which allows rents and rent-stabilized apartments for the rent to be collected at the Section 8 level, not limited only to the rent-stab rent, which we think can help some owners. We have a simple application that people can fill out to show that they have arrears, and we can make that adjustment. We aren't doing it portfolio-wide. We're doing it case by case to help preserve all of our Section 8 resources for everywhere they're needed, but would certainly encourage people to do that. Also, if people need forbearances, if they need reserve releases, please talk to us. Don't suffer silently. We want to be helpful where we can. I think it's really hard. The more I talk to people, and you all know this really well, there isn't a great understanding of why people aren't paying their rent. It is in supportive housing units, it's in affordable rental units, it's in family units and single units, and the lowest income and the more moderate income. It really does not feel, it feels like it's across the board. There's just a lot of tenants not paying rent, and it's creating a lot of stress, and we don't see a clear way to address it because we can't fully identify sort of the why this is happening sort of in a post-COVID era. So we'll continue to work with folks. We also have heard a lot about insurance premiums spiking. That's also adding a lot of stress to property operations already, and so we are very aware of that, and are again sort of working with people. Please call your asset manager and talk to us. We don't want people. While we don't have sort of a magic wand to fix all of this, we want to be helpful in every way we can to keep all the housing sort of afloat and doing what it needs to be doing.
So there was the morning panel on the city's response to this very topic on homelessness and mental health and behavioral health. But I guess the question for you all is, how's the state coordinating with the city to address homelessness and behavioral health challenges?
What was their answer? Just curious. I wasn't here. I had a board meeting, so I just
mixed. What is the ideal approach? What's really happening behind the scenes? And always from the perspective of us in the room, we're always pushing for more. We think that there could be more and stronger coordination, but certainly from you all in the leadership roles, that you recognize that, what needs to happen is beyond the budget, what needs to happen is beyond the vision, and so just interested to hear from you all on how you're thinking about the coordination with the city, because the city certainly is challenged, and it feels from day in and day out, it's a growing challenge, so just how are you guys seeing that coordination?
I mean, we work very well together. We are largely on the same page in terms of vision and the need to provide person-centered services to help, really to be helpful to people, to reduce barriers to assistance. As you all know, the city, Department of Social Services, and now it has expanded, just as much to the, emergency services and health and hospitals with the migrant influx. It is, to say it's a challenge is a serious understatement. It is a serious crisis, and it has put tremendous strain on the city and the services that the city is able to provide. The city is working very hard. We're doing what we can to support them, both with helping to identify sites as well as funding. There's $1 billion in the budget to help offset some of these costs for the city. But, I think the funding is probably not even the biggest challenge. The biggest challenge is really finding space for individuals to make sure that people are cared for in an appropriate way, and also, very importantly, to make sure there are services available to help these new community members navigate what they've been through and to help them settle, whether it's in New York City or in Rochester, wherever it is, to make sure that they're given services. So we have some money, not a lot, where we are working with the city providers and our providers to support some relocation of families if they're interested in relocating, and making sure that it is an informed decision, and when they move that they also have the supports necessary. The other level of complexity here for everyone, both the people in New York City as well as complicating efforts to help people who may want to relocate to other parts of the state, is, as I'm sure you've all heard over and over again, the lack of work authorization. It's such a disservice to these individuals who are able to work and want to work. And what we're doing is trying to move from crisis mode to a more coordinated effort where people are more quickly connected to not only necessary housing and food, but also critical legal services. We're working closely with Department of State and also the City Office of Immigrant Affairs to try to do a much better job than we've been able to do as things have been largely in crisis mode, to make sure those services are in place for individuals, so those who are able to get that work authorization will have a lot more options available to them.
I'd just like to, I'd just like to say that, the city and the state, at a certain level, have always worked very well together on all these issues. And I think with this particular administration, these two administrations, Mayor Adams and Governor Hochul, there's an increased interest, truly, in working in partnership on these issues. I'd like to give just a couple of examples. You've seen a lot of the press about the homeless, our seriously mentally ill homeless on the streets. And while there can be, in the media, sometimes tensions that appear, the reality is that we have meetings every couple of weeks. We have meetings once a month with the city. We talk about the teams we have. We talk about the teams they have. We talk about the housing we have available. And we all work together to try to serve those individuals who, for too long, truthfully, have been forgotten on the streets of New York City. So there's a real working relationship going on to try to make all the various things work together. We know, you guys probably know that the city has something called IMT teams. We have CTI teams. There are the outreach teams from Bowery residents and others on the street. How do they all work together? And we spend a lot of time making that happen. So there's a lot of coordination that comes together. There's been a commitment on both the state, again, for homeless, mentally ill, both by the state and the city for dollars. It doesn't mean there aren't tensions between city and state sometimes. That can always happen. But the reality is that we work overall really extremely well together. And the Office of Mental Health works with the Department of Office of Mental Health and Hygiene in the city. We always have. And all the fundings that flow through, we give state aid, how that goes out, jointly working with you guys on various projects that go through the city, getting approvals, making things happen. So at a certain level, there's a very tight working relationship, but then sometimes on policy and resources, there can be disagreements. But I think overall, the working relationship has been pretty solid. And if we didn't, and I think it can always get better, but I think working together, we've been able to accomplish a fair amount between city and state, both in terms of housing and for some of the most distressed and most seriously mentally ill on the streets. But most recently, it's been a real partnership.
I would just add quickly, I totally agree with this. I've been the commissioner for only a year and a half. I would say it's not even just the relationship between the state and the city, but it's the relationship between agencies, even the state agencies, and then the city, right? And so, what I've heard over and over is that, we're working together in a way that really is way more collaborative than previously. So, we're working with OTDDA, we're working with the Department of Homeless Services, we're working with the Health Department, we're working with OMH. We're just all working together because, as sometimes the point, we get the fingers pointed at us. Those are all the people in the street with addiction, and sometimes it's pointed at OMH, and sometimes it's pointed at housing, and we know it's all, very complex, right? And so we're all really trying to work together to figure out how to do that, how to do this work better. And it really does feel like everybody's in this together to try and figure out solutions, and it's complicated, and it's not just New York, it's a lot of cities around the country, and and there's no silver bullet. So it's even more important that we're all working together and at the table, and I think that's certainly where we are, and really just trying to do our best and think about how to be innovative and take care of this population that has a lot of challenges and has had a lot of disinvestment for decades. We know that the issue's not new, right? We know that it's just exacerbated and maybe getting, more severe, and certainly getting a lot more attention. But good that there's a lot of willingness and more investment to be able to really address this.
Commissioner Visnauskas?
We've had a really good, despite my comment about what they asked, we have a great relationship with the city on the housing front, and we coordinate that with them really regularly to make sure that all the supportive housing deals that are in our respective pipelines are coordinated. We don't want people to feel like they have to forum shop between the two of us in New York City. So we work really closely with them to make sure that every deal that needs to get done can get done.
So, I think at the core of what we've been talking around is about the availability of housing. Creating new housing through the different tools that your various agencies have. And we just ended the state legislative session, which was building up to be a real big year for housing and a state housing vision. It didn't materialize in the way many of us had hoped. But turning back to you, Commissioner Visnauskas, what is the vision for housing policy at the state level moving forward? And how does supportive housing fit into that larger vision? And for the other commissioners, I would say, what do you hope happens for housing at the state level and a housing vision across the various populations and families and communities that we've been talking about today?
Look, I would say it's hard to not come out of the legislative budget and followed by the legislative session feeling a little bit frustrated that their conversation around housing was so front and central, and it was broad, whether it was sort of getting rid of some regulatory barriers in New York City and or looking at sort of statewide housing policies around supply and sort of putting in context the fact that one of the strong reasons why we have such a tight housing market and why there's so much pressure is because we are not building at the rate that our peer states and even our sort of neighbors are building, and that we need to really address that level of construction of housing and grow our supply substantially if we expect this to get any better, right? We can't sort of go through the next decade and assume if we just did what we did for the last 10 years that the pressures are going to get any better. Certainly can't say we weren't, frustrated that nothing came out of that. But look, we have had a really successful first 5-year housing plan at the state, which we really hadn't had before, that gave people real programmatic reliance year over year of what was going to be available. We are now in the second year of our second housing plan. We have enormous commitments. We have $1.3 billion in our budget for supportive housing over that 5-year period to do 7,000 units of new construction and the 3,000 units of preservation. We are sort of well underway in the first year, except for being a little behind on preservation, but I know you're all going to make that up now that I've talked about it and come in and bring us projects. So we are as committed as we ever have been to our housing plan, and our supportive housing production is a big piece of that. So I would say, stay tuned. The governor's incredibly committed to housing. It's hard to not see her do a press gaggle on any topic that someone doesn't bring up what's going on with housing, and I think that's great. I think keeping the conversation front and central, that we really do need changes, and those changes, for the most part, a lot of them have to happen at the legislative level in order to unleash real production, increased production of housing. So I would, I don't think the issue is going to go away. So I think we'll be back in the fall talking about some strategies for next year.
I would just add that, it was definitely a disappointment for what was, while bold, also at the same time somewhat modest, and it still was unable to gain the traction that was needed and the support needed to move forward. We're not going to subsidize our way out of this problem. I mean, we will continue to provide supplements and housing subsidies and vouchers, especially for those who are unable to work, and we need to do that because that's the immediate need. We can't have people unable to afford decent housing, but at the end of the day, we have to do something to control the affordability question, which I think we all think is largely on the supply side. Those investments have to be made, and dare I say, maybe some investments that have some more public control over them as opposed to all private housing.
As a non-housing agency, I think just in terms of the vision, clearly housing is a small part of what we do at OASAS, but we recognize the importance. And I just think as we're moving forward, again, with the worst overdose epidemic ever on record, I think that we really have to think about how to collaborate with supportive housing and how to really take a harm reduction approach, because we need to keep people alive and through a variety of services. And so I think for us, that's the really big point, is being able to provide supportive services, collaborate, and really take a person-centered harm reduction approach.
And I think, very similar. I think what we're doing is, the vision, I think, is to ultimately have, when someone needs a safe, supported housing place to be, that they get it and they don't have to wait months and months and months to get it. That they can get it quickly and it can be a safe, good home for them. We're not there yet. I think that the investments that are being made get us closer. And I think that it's important that the vision is to get there eventually. Out of Ishai, we received probably about 2,500 of the 10,000 2,500, I think, almost 10,000 slots that have been out there for individuals with serious mental illness. We have 3,500 coming now. We have 47,000 that are already established. We have probably another 1,500 somewhere in the pipeline that are going to come up next year. So it's growing, not at a pace that everybody would want, but it's growing. And I think the commitment is truly there. Even this plan for supported housing, as Ruth said, wasn't always there, and it's there now. And the plan for us to grow these 3,500 units is really a huge influx at this point in time. We also have to think, though, about the models. We have to think about what we need to do. One of the things you have often brought up is aging in place for some of our elderly individuals in our supported housing who we don't want to have to move because our housing isn't handicapped accessible, let's say. So we need to use some capital dollars, and we will be having some capital dollars to do those kinds of things so that we have housing for individuals and they can stay where they are and live where they are. So there are challenges that come up even with the housing. Also just making sure that the bones of all the housing are there, that we continue to support and make sure that things are preserved and also that the finances are there. And then there's the supportive people that you need around and how much that costs. And so, yes, there is a vision to continue to grow this, and we need your advice, and we're not there yet. But I think every year, and certainly with this budget, I think it's a significant jump in terms of trying to do a lot of housing for individuals with a serious mental illness.
Okay, it's your turn. For anyone who has questions, if you can step up to the microphone, announce yourself and ask your question, that would be great. Thank you.
Hello, everybody. I feel like I'm about to perform. We're not going to do that, though. So just one thing struck me, and I'm just want to kind of center something, if that's what I'm doing. Here in the city, we have this big thing between, we have the migrants, the overflow, the overburdening of our shelter systems and stuff like that. So a lot of time the language that comes out, it causes so much confusion and the media goes crazy. And so I would like to see a lot more perspective given from the state level and the city level in order to center the right conversations. So when I hear something that, like we put this notion out that, we have the migrants come and they want to work. Then all these resources going to help make sure the migrants could work. And we do need that. But I also think about, the people that have been here that are in these shelters. I myself was one of them. And they want to work too. They want the same things that any migrant would want. And many of them have been waiting, languishing in these shelters for years or in the streets. So I want to make sure that as we rally resources and funding and stuff like that, especially from the state level, that we don't forget to prioritize those people that have been here, that have been stuck in shelters, and that have been waiting to access housing, and that we kind of put some of them at the top of the list. I point out the numbers that show that, I don't know what it is today, but 27,000 children are in our shelter system here. And we have to prioritize those families whether they came yesterday or Absolutely. They came years ago. They need to be prioritized. And so I just want to make sure that we're doing that in the conversations and that we're able to say these things in the right way so that, people in the city, the citizens and the state are able to understand it better, and also those of us who are impacted by these issues are able to feel that we're not being neglected. So my question.
That wasn't a question? I didn't think it was a performance.
No. I thank y'all for y'all work. I know it's a lot of hard work, so I just appreciate everything that you're doing.
Yeah, well, thank you for being here and for your comments. Certainly it's, I would not say that we're prioritizing one group over the other. It's just that the sudden and significant numbers of individuals coming and arriving with literally nothing has definitely stressed the system beyond belief. And actually, one of our primary concerns is the stress that it's putting on the housing that is available and the providers that are being asked to support other services in more locations, because there's no question that some of the level of services and the length of stay, even though there were fewer people coming into the shelter system during COVID, there also, there wasn't that level of service to help people exit the shelter system, in some ways for good reasons, but in other ways it's time that we really get back to that business. And that's something that we absolutely prioritize. So the length of stay in the shelter system in New York City is absolutely too long, and it's absolutely unacceptable for families and children to be in that situation where there's just not enough stability in their lives. And so we definitely consider that an absolute priority. And, but it also goes back to the conversation about housing. We have vouchers that families have, but they can't find a unit that will take that voucher. And there are reasons other than supply for that we are trying to address, but that should not be, right? They have the funds available, but there's not enough housing because the length of stay in shelters is much too long, and we need to reduce it. Thank you.
Thank you to all the commissioners and deputy executive commissioners. This was like an amazing forum. 3 things I just want to put on the table, and I've spoken privately with some folks about this as well today and other days. The new immigrants that have come with significant trauma and mental health needs, and do come with some of the substance use issues that come with responding to trauma and mental health needs. But they are uninsured. And while you may be working through health and hospitals for some support in New York City, that's not going to be the total answer, and certainly not for the borough of Staten Island. There really needs to be some kind of funding made available to provide treatment, mental health treatment, or integrated mental health and substance use treatment, or behavioral health, or whatever name you want to call it, to provide those kind of resources for the folks that are coming into our communities. Secondly, that there's a real need for us providers in the community to figure out how to make the integrated license for behavioral health possible, and the amount of consulting money it's going to cost for people to get through that application process. All of our services are integrated practically, but not integrated by license and by funding. And in particular in mental health, there really is no net deficit funding. There is some on the OASIS side for clinic services, but not for OMH. And I believe we will be closing our mental health services if we can't figure this out, because the deficits are so great. And finally, the one thing we never talk about, and I don't know how to talk about, is that in creating housing, we continue to create housing in very poor communities of color, because there are unseen lines that when you cross into the white communities, all hell breaks loose, or worse. And I don't know how to tackle the issue of racism politely, delicately, or strategically, but somewhere there has to be some discussion at some level as to how to break through communities and build whatever needs to be built between communities to allow housing to occur in communities that are not necessarily impoverished and communities that are not necessarily majority people of color. And I don't know the answer.
So Commissioner Sullivan, I think the first question is to you and maybe Commissioner Cunningham, and we'll unpack it.
Could you just remind me?
Yeah, so the first question was about migrants and their trauma.
Yeah, we're working with the city. As migrants are beginning to expand too across the state, it's not just New York City, but now migrants are settling in other counties across the state. So we work with the counties to talk about the kinds of mental health needs, et cetera. There's screenings that go on. The health and hospitals is, at this point in the city, my understanding is that they are what's major league working with the migrants. But yes, we're working together. We're planning. We're getting a sense of what the overall need really will be. Some of the migrants move on. Some of them stay in the city. There's various things, but we're working together with the city on this one. And I think so far Health and Hospitals is doing a lot, and we'll see what the other needs are. So just to know that, yes, everyone's aware of these kinds of issues. And we've just got to work together to try to provide the services. And these individuals, lack of insurance will not stop people from having services they need. Let me just say that.
And the second question was about funding levels for integration of services.
Yeah, we can talk with you specifically about that, but there's a lot that can be done. Let me just say there's a lot that can be done with the individual licenses that already exist under substance use. There is some difference in the funding, but we'll be glad to talk with you about some of the specifics of how you can work that, because some clinic systems have been successful. Some of them have gotten the dual license, some of them the integrated license, some of them have not, but been able to still provide the services. So we can talk with you. Maybe we could have the teams, OMH and OASIS, talk with all of you about those kinds of systems and how we can do it. I think we can also offer some technical assistance on getting the integrated license, and we're streamlining those kinds of processes. The integrated license does give you a little bump in some places for funding, but overall, you can do a lot with the individual license that you have and get pretty good funding as it exists. So we will be talking. We can share that with you.
The third question is for the entire panel, which was about the quality of the housing that's being created through the various programs and how to tackle the discrimination that is preventing, building throughout the state, throughout the city, and not relegating housing to just low-income communities.
So I can start a little on that. I mean, certainly central to the work we were trying to do this budget and legislative session in our housing efforts was making sure that every community was doing their part to build housing, because there is not equal production of housing or affordable housing in all communities across the state. And we take a focus in the work that we do to look at well-resourced areas and make sure that housing is getting built there. But it is very hard to get projects in some communities through local approval processes, and you don't have to go very far into the blogs to read about 3-year and 5-year timelines for folks to get through processes. We released a big study last year called Fair Housing Matters that looked at fair housing across the state and has a lot of strategies for ourselves, short-term and long-term, around how to address some of those issues. It's going to be a long haul, and I think certainly without something like the legislation we proposed last year to make sure that every community was in fact building housing, it's going to be even harder to make sure that happens. I would also note, not only to say negative things, because I'm going to think of a positive one to say before I finish, but yesterday there was also a decision that came out around source of income and whether landlords can discriminate based on a tenant source of income. That was not that was an unfortunate decision. So the challenges are real, and they have been around for a very long time, and they will take a long time to unravel, but I think certainly we're talking about them. We're calling them out for what they are. Certainly for our part, I think we've tried to identify a series of strategies to make sure housing can get built that we're financing, and we're incentivizing that and encouraging that, and would certainly love to continue to work with anyone in this room that is trying to get projects like that developed so we can be as supportive as we can be.
I also just want to comment. I really appreciate that comment. And unfortunately, it's not an issue unique to housing, right? I mean, this is something we see all the time. We hear about all the time, the pushback from communities around addiction programs and clinics. And I'm sure the same thing is true, right? I mean, so we're seeing it around housing, mental health, substance use, asylum seekers, where communities are really pushing back in this way that feels sort of more extreme now than ever. And so I think we also just, at OASIS, are trying to think about creative ways to sort of spread the services that may not include a new, for example, opioid treatment program that provides methadone, but instead incorporating that in the existing programs that maybe don't provide methadone but could provide methadone, or using mobile units to provide methadone in communities that don't have the brick and mortar clinics. So I think we're really trying to think about ways to do this, but that pushback is, very much we're feeling it in all of these different ways. And so I think we have to talk about it, we have to acknowledge it, and really talk about there are needs for services for all of these populations that are marginalized and stigmatized.
Yeah, look, I agree with everything you said, but I do think certainly when we go out with housing, when we go out with your providers here to communities, we're certainly talking about this, and we're really bringing it up. It's not a hidden issue. The reality is that there's massive discrimination in multiple levels in our society. That's very sad for a very rich and productive society to have it. It's at so many levels. There's racial discrimination. There's discrimination against individuals with mental illness, and people still don't want certain services in their neighborhoods. Our most successful approach has been when a provider comes who's been successful, you've got to begin somewhere else, who can describe what happens when those buildings go up. And it's nothing, your property values don't go down. People don't run away from your neighborhoods. In fact, neighborhoods can grow and prosper when you do this housing. And I think that that's something we have to get out there. We try to get it out there, but there's still tremendous discrimination. And it goes way back. There's discrimination, as Dr. Cunningham said, in just about everything we do, whether it's we're putting up services. Our payment systems for services are discriminatory against individuals. Parity is something we've all wanted for decades, and we don't have. So it's a constant battle. But we need all of us together to keep making noise about it, and I think it's slowly inching and getting better. And there are places where we've been able to do some really lovely housing in real middle-class neighborhoods. It's a little easier, sometimes a little bit upstate than in the city, let me just say that. But we've been able to put up some really nice housing in some very middle-class areas, and people have welcomed it. So it's beginning to happen, but it's a struggle, and we're with you on it. But I think we've got to just keep the struggle going.
I'm sorry to be the bearer of bad news. I think you might be our last question, as long as it's not multi-part, or just keep it to one so we can get maybe the person behind you. You'll be our last question. Okay. I think everybody will humor us for a couple more minutes. No multi-part questions. Sorry.
Oh, and I actually did have two questions. So my name is Sabine. I'm from the New York City Department of Veteran Service. If there's any service people in this room, thank you for your service. Now, you mentioned that there are 10,000 supportive housing units available. I would like to know how many of those units will be set aside specifically for veterans. I understand the mental supportive housing need for everyone overall. I understand that. But what I would like to say is, out of the 300 million individuals living in this country, less than 0.3% step up to serve this country. I feel like, as a country who constantly speak about how much we appreciate our veterans, we only speak about that when it's time for election. When it's time to do, there is mostly silence. I would like the speaking to now become factual. How many of those units is anyone willing to committedly say, we're going to set aside for our 0.3% of the individuals that protects the 300 plus million? How many of those units can I get?
Sure. So the 10,000 is a 5-year commitment, and it's funding that's available for developers, nonprofits, and mostly nonprofits to come to us for supportive housing projects. So we've just finished our first year. We have to do about 1,400 a year to make the 7,000 over 5 years, if that's the right math. But we really will take any supportive population that people bring to us. So that can be veterans, it can be domestic violence, it can be youth aging out of foster care, it can be frail elderly, it can be mental health. We don't have any specific buckets for how many units of any of that we do. We certainly do a lot of, we just did a veterans project out in Long Island recently. We love our veterans projects, and would be happy to do more happy to talk to you after if you want to talk about some projects that you might know of that could come talk to us.
I would just add that within our HHAP annual appropriation of $128 million, we do have $5 million that's set aside for veterans. It doesn't mean it's limited to the 5, but we do reserve that $5 million for veteran services.
And how would we access that?
Through an application to the Homeless Housing Assistance Program, and we can certainly would be happy to speak with you. It's for capital development.
My second question is, and I'll make it really quick.
No, I'm sorry. Maybe you can come and talk to us after. Okay, thank you.
Thank you. I'll try and be brief. I'm Dan Johansson from ACMH, Care Management, Housing, SOS, and ACT here in New York City. I'm interested in your thinking about the affordability crisis, in New York City in particular, I'm sure throughout the state. So for our workforce, we have 1 in 5 positions unfilled, and we certainly need to do more about salary and wages, but part of that is that people can't afford, our workforce can't afford to live in New York City anymore. Curiously, in the last couple of years, when I've gone to communities and community boards about new projects, the conversation has been less about NIMBY, and it's more about your apartments aren't affordable enough. This morning, HPD, the commissioner, stated the intention to look at those affordability rates. It means bringing more money, clearly, to subsidize, but is there some thinking, can we do more to support, a lot of working New Yorkers, including our staff that just can't, we can't fill our positions. People can't afford to, live and work in New York.
Yeah, I mean, sure. Yes, thank you for the question, and much appreciated for especially all the staff that work in every building we finance, and everyone else as they are the front lines for us of this work. I would certainly say, we try to serve a broad range of incomes, and we are not always sort of dictating them ourselves. They really come from usually a local process. Sometimes that is a good process, and sometimes it's, not, depending on where we're working. But I think happy to certainly say from our perspective, we are always looking to serve as broad of a range of affordability as we can, including going very low.
So thank you for that, and thanks to all of you for an amazing group of leaders, and also at the city and how you're working collaboratively.
So thank you for that question. So thank you to our panelists. We really, I'm encouraged by the visions that you guys articulated for your agencies, and that integration, that coordination across the agencies and with the city, which will be increasingly important. I think the room is going to hold you to that. So enjoy the rest of your afternoon. Bye-bye.